next speaker, Ali Maggs, understanding the challenges and key barriers of vaccinating, where to focus and prioritise time and resources. Ali's a nurse educator, content specialist, has taught over 1,000 nurses about vaccinations, and currently content specialist at Benchmark, works at Queensland Health and teaching at Southern Cross University. So, Ali.
Good morning and thank you. I was challenged with the task of understanding challenges and key barriers of vaccinating, where to focus and prioritise time and resources. So looking at that, with the learning objectives I considered was, how do we identify the barriers and hesitancies that can impact vaccination uptake? How can we then improve opportunistic vaccination by determining the target groups? And then how do we implement getting the whole of the team on board so that we can increase positivity within the team itself, but increase positivity within our community that we wish to be vaccinating? So what we're finding at the moment with a lot of the research that is coming through, routine immunisations for some Australians, as we know, have fallen out of favour. So with evidence that's currently being produced that potential vaccine populations, they're no longer choosing to have age recommended or travel recommended vaccines, and this is quite concerning. So identifying what the main barriers are and how to open the conversation, but with limited time and resources, can be really challenging, because we would all love the opportunity to sit down for half an hour and have these conversations, but it's just not practicable. So can we discuss what opportunities can be created and how to include the whole team in promoting vaccinations across the whole of the lifespan? So I'm looking at the evidence first, and thank you to NSAIDs for providing such great information, and they're one of my go-to places when I'm looking for information. So there is a summary that they've produced on the barriers affecting childhood immunisations. The aim of the study was to understand the barriers to uptaking of the nationally immunisation program vaccines among children under 5 years of age. And for this, they use the Vaccine Barrier Assessment Tool, VBAT, which includes barriers on different areas, and it's also broken down into parents' thoughts and feelings and parents' acceptance with the barriers. So looking at what we can see here, that common barriers that were reported by all parents, 60% of parents reported feeling distressed when thinking about vaccinating their child. Now, I know as a parent myself, it's different. I'm happy putting needles in arms all the time. I'm really happy. I'm not so happy about having it for myself. And when it was my turn to get my own children vaccinated, I wasn't all that happy. So I do understand the reticence of people in actually asking their children to have that moment of pain when they get that vaccine put into their arm. So we also found in this summary that 11% of parents reported an access barrier, that they couldn't afford the costs associated with vaccinating their child. Now, obviously, we know that the number of bulk bill clinics is reducing, and there is a fee into coming into quite a lot of clinics. There are alternatives in areas. I know that we've got council clinics, government clinics that are being run. There are still some bulk bill clinics that are available. But certainly cost can also be transport, access, how far away they are from getting into a clinic itself. And then we've got almost just over 9% of parents reported that it was not easy to get a vaccination appointment when their child's vaccination is due. And certainly I've found over the last few months, and speaking to a number of other nurse immunisers that are working in clinics, that this seems to be the case, that actually getting an appointment at with your preferred doctor can sometimes take up to 10 to 15 days. Certainly in Melbourne, it seems to be longer than it does a little bit up here in Queensland. But you can see that these are some of the barriers that they're showing. Pulling up some of the graphs that they put up into the summary, it was interesting to note that if you look at the light blue line, you can see that it's the parents with unvaccinated children. So what's interesting is that their level of barrier remains quite high. But when we've got our parents with up-to-date children and parents with partially vaccinated children, obviously it's a lot lower other than the feeling distressed when thinking about vaccinating a child. You can see that in other areas, the percentage is still quite low. But it still means we need to have conversations. And certainly what this graph shows to me is that the really beneficial conversation is to the parents with the partially vaccinated child, because there's a lot of growth. They could go one or the other way. They could go up to being non-acceptance to actually coming down to bringing their children and getting them up to date. So it was interesting, some of the criteria that they do not intend to give children all recommended vaccines, don't believe vaccines are safe for the child, would not feel guilty if they did not vaccinate the child and the child got a vaccine preventable disease. I found that an interesting question that was asked. Don't believe that vaccinating children helps protect others in the community. Not believing that vaccines are effective for preventing diseases. That's our message that needs to get across a little bit more clearly. Vaccinating on time is not my responsibility. Then whose is it? I do query that one. And then obviously the big one for everybody was that the main barrier about feeling distressed about offering pain up to their child. So the next graph that I just wanted to bring up was the acceptance barrier of social influence. So we can see here again, our parents with unvaccinated child obviously are higher than everyone else. But what was really interesting in that first graph is that the number of people now who do not trust information received about vaccines from the child's doctors or nurse. So it seems we've got some work to do. So it seems as though our conversations maybe just aren't quite hitting the mark. So we need to think about perhaps how we are phrasing our questioning or how we're putting everything that we're saying. Moving down to the second, access barrier, which is a practical barrier. So again, we had a couple of high hits in our parents with partially vaccinated children in not to prioritise the child's vaccination appointments over other things, that it's not deemed as being as important as it should be. And again, moving down to cannot afford the costs associated with vaccinating a child. And again, it's not easy to get an appointment when the child's vaccination is due. So this is obviously now we're seeing where some of these barriers are. NCS, again, they produced a insight survey around the drivers of influenza vaccination in adults. So leaving children and moving on to adults. I picked out just some of them. There are many more of these, and obviously you can get the report from the NCS website. Influenza is an important cause of hospitalisation and death in Australia, with an estimated 3,500 deaths and 18,000 hospitalisations on average each year. There were last year over 250,000 notifications of laboratory confirmed influenza cases, and the rates were obviously highest among age 5 to 9 years, followed by children under 5s, and then obviously our at-risk population of our age 65 years and older. So again, looking at the outcomes of some of the survey that they produced for adults over 18 years, we've got nearly 85% of adults 65 years and older said that they wanted to get the flu vaccine, but the evidence has come up that only 60% of people were actually vaccinated. So how did we lose our 24% that wanted it but didn't come and get it? So looking at that as to, is it the barriers, is it transport, is it cost, these kinds of things. But that 20% who want it, and I know we've increased access. We've got our pharmacists, again, we've got our clinics outside, there's corporate flu vaccines. There's a lot of access to getting the influenza vax. So where are we missing this 20%? So the adults who did receive the flu vaccine in the last 2 years were 10 times more likely to want a flu vaccine than adults who did not receive a flu vaccine in the past 2 years. So we've got a captive audience. We've got an audience who do want the flu vaccine and come regularly, who want to come and get it. But we need to start those little conversations around those who don't regularly come into the clinic or come into the pharmacy and access that option. So they came up with adults who received recommendations from healthcare professionals to get a flu vaccine in the last 2 years were 1.7 times more likely to want a flu vaccine than adults who did not receive that recommendation. So again, it's about language. It's about, as I'll go on in a little bit, it's about formulating a key phrase that potentially may stick with the person, go away, percolate in their brain, and come back and think about and maybe come back and actually receive that flu vaccine. So adults with chronic illnesses, were defined in the survey as obesity, diabetes, lung disease, high blood pressure, and other conditions were 1.5 times more likely to want the flu vaccine than adults without chronic conditions. And as Paul alluded to before, well people, in the question that came in, well people, why do they need the vaccine when they've not been unwell? And it is a conversation to be had. And at the end of the day, if they say no, then that's okay. But if we've had the conversation, it percolates in the brain still. And that's obviously what we're looking for. So how to prioritise time and resources. So I put my mind to this and I actually thought about the good old upsell technique. Do you want fries with that? Or would you like that to be a large? And I actually looked a little bit behind the psychology of that. And what we're actually wanting to do is what is classed as cross-selling strategies. So the timing is crucial. We want to offer these suggestions at the right time in your client and patient journey. We want to provide value, only suggest vaccines that will offer impactful health benefits, and don't overwhelm, avoid bombarding the client patient with too many options. So one of the ways we can do this is by using passive knowledge and passive learning, because part of this mandate was if you're limited with time, we actually don't have the advantage of having the long conversations. So what can we do in short bites that may actually be impactful in the long run? So promotions is obviously an easy one. And again, passive knowledge and passive learning is a quick way of doing this. So arranging whole of teams. So whichever way you work, whether you be in a medical centre, whether you be in a hospital, whether you're with the council clinics, community clinics, pharmacies, we work within a team. None of us are isolated. So we need to obviously involve our patients and get them on board. Potentially promotions like poster competitions for children, these kinds of things. Hey, the season is coming up. And certainly the advantage with the flu mist coming on board and Queensland offering it for free, we certainly could start a promotion now about, hey, what about when your child comes in, we've got this non-needle flu vaccine now. Keep track of local events and national events like National Immunisation Week. We certainly can use promotions around those things. Now, Valentine's Day. I put together using Google Gemini, which is an AI, and I just put in and it made me this lovely poster, Protect Your Loved Ones this Valentine's Day. Now, I will go back. I worked under Professor Paul Van Binder, and he always tells the story around giving his beautiful wife for Valentine's Day, the Shingrix vaccines, because he loves it very much. And you know what? That stuck with me. And I thought, you know what? That's brilliant. That's really cool. How about we play with that? You know, why not? What about Mother's Day? Hey, Mum, before you go in and I take you out for dinner and here's your flowers. But by the way, we're going to stop by the clinic because I've booked an appointment for you to get A-beams. Why not? Let's have some fun with this. Let's try, our rates are reducing. Let's try and get our people in. There's Father's Day, Grandparents' Day, NAIDOC week, but have some fun. And obviously you can create your posters. And I know we're time limited. This took me 5 minutes, just putting a statement in, create a poster, putting it in, and it came up with that. I can print that out, put it on the front of the reception desk. Who knows, it may offer some interest. So resources, let's use what we've got available. Reach out to the pharmaceutical companies, and we've got some here today for you to chat to. They've got posters, videos, brochures. They are delighted to share what they have spent many months producing and what is available. PHN reports, what's affecting your area, so remaining topical in what's actually happening locally. Subscribing to Immunisation Handbook, NSAIDs, Immunisation Coalition, MVAC state and territory health departments, because they put out newsletters, and those newsletters is what is topical right now. So that might help us create our promotion. Using topics from the Questions About Vaccines booklet. I think we've all forgotten about it. It's an awesome resource. Think about, oh, I don't want aluminium in my vaccines. Put a little note out and put it where the public can see it. You know, in your clinic, in your waiting room, those kinds of things. There's hundreds of topics in that Questions About Vaccines booklet that you could put out. Create a poster. It's a really easy way. So use what you have available. Having already on a little slip of paper the website address for sharing knowledge about immunisations website for Sky, as an, you know, I know you're busy, you're about to go and your children have your vaccines, but here it's really beneficial having a look at this website, you know, to consider maybe getting other vaccinations. The Matter of Vax video series from the Immunisation Federation of Australia are awesome. I don't know whether there's a way you can put them on your TVs in your waiting room and have them on loop. These kinds of things. So be innovative and think about what we can do. So whole team approach. As I said, we're not a singular island. We do work in groups and we collaborate. So start at reception. And this is where do you want fries with that approach? Will work. So hello, Mrs. So thank you for your appointment. Today, your doctor's, you know, on time, have a seat. But before you go, would you like me to make an appointment for your flu vaccine coming up in the next month or two? If you can get your reception staff onto that, it just becomes the norm and asking these questions. So again, we can change the dialogue, whatever it may be, or that little sentence each time. Or when you go into the doctor, be sure to ask them about a free vaccine you might be eligible for. It's percolating in the brain already. So handing to clients and patients brochures from the pharma companies, you might want to have a read of this before you see the doctors. It might be of interest to you. So somehow since COVID, we've stopped handing out brochures. We're frightened of people touching things, germs, they're bad, they're awful. Yeah, have you ever found anywhere that now, other than hospitals and doctors' surgeries, where there's now hand sanitizer? You go through an airport, they're nearly all empty. So I don't think people are as scared of germs as they should be. But having literature available in different languages, obviously knowing your own cohort, and images, videos, or posters which may increase curiosity. So I liken this to the drop in the pond. We all know the ripple effect. One small drop of thinking or considering, they may go into their social group and have a chat about it. The doctors today, I saw, I heard, I thought about. That person may then think about, see, and change and make decisions based on that. So during consults, and busy as, work on yourself some key phrases that sound like it's coming from you. That's easy to do at the end of maybe a consult. You know, for your child, maybe like, did you know that we've got a needle-free vaccine for children under 5? It'd be really great for your kids to get the flu vaccine this year. That'd be a great way for them to have it. A simple sentence, and about any vaccine you wish to promote or any vaccine preventable disease you wish to cover in your clinic. Just have pithy little one sentences that you can throw in. Use props, and that's your posters. How often are we changing the posters in our rooms, in our consulting rooms? Or do they just become wallpaper? Do we even notice that they're there? So change them around, create them, have some fun. Again, I went on to Google Gemini. Ever had shingles? Let's talk about it. Schedule a consult with your doctor today. That's an easy one, because after a year of their last episode, and if they've had a severe episode, they absolutely may be more than willing to pay that $500 or so for their 2 doses. You know, if people don't know about it, they won't know to think about and get it. So obviously during Fit to Drive consults, that's the right age group that we're looking at to increase our vaccines, health checks, and making suggestions to the companions and family members that come in and are sitting in the room with you. They're a captive audience, you've got them. So maybe you can increase what they're doing there. In the treatment room, for the nurses who are in the treatment room, I know that at many stages I've had people trapped on a bed. Either well, you know, they're mine, they're not getting away. I've put the arms up and everything. Again, posters in the treatment room are really important. Colouring in for children while they're waiting for mum to have something done or a family member to have something done. Talking about bugs. Hey, look, this is bugs. How about you colour this in? Target, again, companions and family members. Specifically with our pregnant women coming in, we're talking to the fathers, significant others. We're talking to the grandparents in shared housing accommodation. Who else in your housing can come in, you know, who might need to have this vaccine? But having a short, pithy sentence can encourage people. Obviously, during procedures, wound dressings, during childhood immunisations, and again, making sure we're running reports on air and also the ones from the PHNs, using that information to target the areas where we're lacking that we can potentially increase. If you have time, and I know at the clinics that I worked at, I would never have had this time because mine was a walk-in $15 doctor clinic. I wouldn't have had time, but certainly a lot of clinics, there is that opportunity of checking air before your client does come in. And if you can, it's an excellent way of thinking about what the conversation is coming in. Now, I did just want to throw this oldie but goodie in because I think it's still of real value to everybody. And it's the halo. When we're looking at our client and we're looking at who may be lower down on their immunizations, we've got to think about their health. What is the health that is a concern? Do I have a vaccine preventable disease in my fridge vaccine that I can give them or I can talk to them about today and they can consider and maybe come back at a later stage? Age. The NIP is all age-based. So that's an easy one to focus on. Lifestyle, again, knowing your cohort. And again, Paul mentions the aged care facilities, but let's not forget about our boarding schools. Let's not forget about our other condensed housing like shelters and for homeless who may be in shelters. But also during COVID, when I was working in public health, a number of the first ones that came through were church congregations. There are a lot of impact from there. So again, knowing your cohort can help you develop whether your conversation towards what vaccine preventable diseases you might be able to talk to them about. So we've obviously got our smokers, people who are obviously heavy on alcohol, our sex workers, travellers, people in custody, obviously, or have been in custody is another one that is a consideration. Occupation, we all know about ourselves, we're all vaccinated, but we need to think about when somebody's coming in, our first responders, our corrections people, and I'm a bit sick, I like to think about people who work with blood, dead or feces, because that gives me a great pool of occupations that I can talk to about different diseases and what kind of benefits. But again, unlimited time, you've got to have your pithy little one-line sentence ready to go. And you can create a list, maybe have it on the wall, that one, because one sentence won't fit all, but have a few and work them out. But everyone's halo is different. So just in conclusion, and there's my drop in the pond, I do believe every conversation or every comment, that passive learning is really beneficial because it percolates, it's the drop in the pond. And although we may not get an immediate effect, we may have an effect further on as that ripple goes out. So in understanding the challenges and concerns for our clients and patients, a simple and focused approach to increasing vaccination rates can make a difference. Having one targeted statement without too many options, include the whole team in vaccine preventable disease promotion. Again, be okay with not getting an instant result. Think from the long term that if we get people coming in long term, then that will slowly bring those barriers back down. But the short time taken in making your statement is never wasted. Use your resources that are already available, as so many of them are already patient-focused, free, and easily accessible. Thank you.
I think we've got time for one question, but coming online is the theme of GPs are concerned that their been criticised for not being accessible, and some pushback to say that the funding has changed and been withdrawn, but maybe that can sit on the table as one of the concerns that we've got. And one of the suggestions is that we don't talk about Wakefield, and because by talking about it, we're reinforcing it. So let's not talk about the fact you can't see a GP. Anyway, so there's some of the questions. Also, there was a comment that Queensland, New South Wales, Western Australia and South Australia are all offering flu mist. So I'm going to be interested. We put some bets on the table to see whether we're going to have complete 90% vaccine rates for flu next year, because what will be our excuse next year? Another question, yeah, basically around access and inconsistencies between the states is sort of the questions which you've talked about. All right, thank you. Thank you very much.